Doctora Nina Shapiro, es una excelente cirujana. Voy a tratar de buscarla por aquí, a ver si ya la tengo a la mano y le voy a mandar la invitación. Eh, Muy interesado de escuchar lo que está pasando. Gracias, Batia, por venir aquí. Soy Mejor Mujer. Hola, un placer verte por acá. Benny, pleasure. Hola. Ya llegó la doctora Nina Shapiro. Dr. Shapiro is here. I'm going to try to invite her, and I'm looking forward to hear from her. And yes, and I hope that waiting. Okay, and she's coming in. Perfect.
Here we are.
Dr. Shapiro, thank you for being here.
Thanks for having me.
Oh, it's really a pleasure. For all disclosure, and everybody that is in front of us, we are not related. Yes, we have the same last name.
Maybe we are.
It could there could be a link there somewhere. And another disclosure, I run away from blood, and Dr. Shapiro is an amazing ENT surgeon that, apart from having an amazing brain and way that she explains absolutely everything, she has had the pleasure to create a book that that was actually one of the. I have two links with you that I want to share. One is actually Dr. Kelman, Michelle Kelman, that speaks highly about from you and about you. And the other one is actually your book. You have a way to engage people and actually explain what's happening. I'm Mexican right now, working in LA. I chair a lot of the health education and wellness here for a group that we have 300,000 patients from LA County to Orange County. And I need your help right now. One of the things that we're having is an overload of craziness out there of what's happening. I'm hearing this. I got, an email saying that, the WhatsApp, my there's a phrase, comadre. It's kind of your best friend
Yeah.
saying gossip
Right.
regarding that. And I want to clarify between you and me a lot of this chatter that we're hearing, and make sure that our community, wherever they are in the world, understands what are the bases of this, if there's any base, and how can we better protect ourselves. And if you want to, you're welcome to say, where you're coming from and the stuff that you're doing.
Sure. So thank you again for having me. We're probably long lost cousins. Who knows, right? So I am a pediatric ear, nose, and throat surgeon at UCLA. I've been there for a little over 2 decades. And that's my main clinical work, obviously. But just living in Los Angeles, living in the world, we're exposed to so much information. Before COVID, there was a lot of hype going on. And that's why I wrote this book. I'll show you guys. Here it is. Woohoo! And so I had inspiration to write a book and to sort of act as a communicator to bust myths. And we are living in this world now where as much information we're getting is good, there's 10 times as much information that is not good. And we are all subject to this. We're overwhelmed with our, we're all on some sort of device now, 1,000 times more than we usually are. And it's really hard to figure out, how do we understand what's real, what's true, what do we do, how do we keep safe, how do we keep our families safe, how do we keep our families safe who are not living with us, when can we go back to work, when can we start living our lives. And you can get as much information as you want, but it's really important that you get good information. And I think one thing we need to understand is, what does that mean by good information? And, I always like to say that information, the more boring it looks, probably the better information it is. If anything is really glitzy and has a lot of bells and whistles, it's probably, a little bit of a myth thrown in there for sure.
Well, you know what we can do? Let's start with the things that are like medical stuff. And after that, we go again, we go more on the organic and alternative and naturopathic way. Then we're hearing a lot about this. I'm not going to say on purpose the generic name of this drug or the brand name of this drug, but we're hearing about this medication that is used for 2 specific diseases that helps with everything. And everybody's actually asking me, I want that medication. And
Right.
what are your feelings regarding that right now? With what stage? What are you hearing regarding medications?
Right. So there are two medications that one is an antibiotic. That's a very sort of commonly used antibiotic that we use oftentimes for respiratory infections, cold, mild bacterial infections. The other one is a less commonly used medication that is used for malaria or prevention of malaria. And the combination of those two have been tried in patients with COVID-19, either during an acute process or even consideration for prevention. And there have been some studies showing some great outcomes with this. And I know people personally who've taken these medications and have recovered. Did they recover because of these medications, or did they recover in spite of these medications? Who knows? Just because I know somebody who took it and is now well doesn't mean that it was the medication that made them better. COVID-19 is a virus, and these are antibacterials. So it's not really clear if they have anything to do. What we do know is that these medications have potential serious side effects, not so much the antibiotic, but the other one has some potential very, very serious side effects, primarily to your heart, causing fatal arrhythmias, meaning that your heart can be so fast that it stops working and you go into cardiac arrest. So these are no joke. You don't want to try them. You don't want to buy them online. You don't want to sort of import them from another country because they don't have any more here. One of the medications is a really important medication for people with autoimmune disease such as lupus, and so they can't get this medication, which they've been taking for years to keep them safe and healthy. So when we hear something like this, when we hear of this amazing potential cure, it's very enticing to say, let's take it. I want it. I want to get it. But we need to do trials. You need to do trials, and these take a very long time, and they need to be studied safely and without hurting people. And they're still giving it. And again, some people are having great results, but you don't want to do this on your own. You don't want to just request it because you've heard about it. You need to be under the very, very close watch of your physician, usually in the hospital, if you're going to be taking any of these medications.
And a lot of the first comments was like, it's 100% effective.
Yes.
And whenever I see 100% of anything, it's taxes here in the U.S. and death. That's the only two things that I can guarantee someone that's 100% effective. And that's the things that we need to. That's the moral compass that and as you said, if it feels like it's amazing and it's coming like a miracle.
No. Yes, nothing is 100%, as you said, death and taxes. Although taxes are delayed now, so we're in a little bit better shape. But yes, nothing is 100% effective. Nothing is 100% safe. That's the other thing. So we talk about safety and efficacy, and nothing is both of those.
And you put like right now an interesting comment on that one is that right now we're hearing another part. It's all medication that we used to use for inflammation and pain and stuff like that. That they're saying they're bad for us, and and everybody's like starting to jump on it. And it started in France with the Minister of Health over there, and it started like rumbling a lot of things. And we know that you have certain things there that could be true, but still, even though that we feel that we have been done this for like decades, coronavirus has been here for 3 months and a half. Right. There's a lot of things of learning for us.
Yeah. There's a lot we don't know. Yes. So some of the medications that we would typically take for a fever or some muscle aches now are considered absolutely not. Don't take this before the infection. Don't take it at all. Don't take it while you have this infection. But again, we don't really know. We talk a lot about cause and effect and correlation. So, it was raining when I had this illness. Did the rain cause my illness? Probably not. Who knows? Probably not. So but when you have these medications and you're getting sick or getting sicker, you don't necessarily know if the medications are making you sicker, if the medications are making you better. And it's not to say that we don't know anything about the disease. Obviously, the people who are on really the front lines know a lot about this disease, a lot more than anyone else. But we can't just discount one medication to say it's terrible. And we can't also say that this is necessarily the cure-all and everyone needs to take it.
I agree with you, and one of the chapters that I really enjoyed from your book, and another one that that it was actually talking about vaccines and how important they are to create that sense of protection to our communities, and being
Right.
one of the best things that we have ever had as public health per se.
Right. Right.
Um, and one of the interesting things is a lot of people are asking me, like, where is my vaccine? Like, okay, you didn't get your flu shot, and you're asking me
Right.
for the coronavirus. Like, okay, there's a disconnect there. What do you think about that?
Yeah, so first of all, I'm hoping that everybody's going to want to get this vaccine. And if and when it comes out, and it may be another 12 to 18 months from now that we even have a beginning of a vaccine for coronavirus, I am just hoping that people will get it. And now that everybody is so terrified about this illness, I am hoping that people will not be terrified about getting a vaccine, because I think just, anytime a new vaccine comes out, there's going to be anti-vaxxers for it. Anti-vaxxers are not new. They're not from Google. They're not from some talk show. Anti-vaxxers have been around as long as vaccines have been around. Hundreds and hundreds of years. So that fear is real, and that fear is not going to go away. But I really do hope that the vaccine will be the way to protect people, not herd immunity where everybody has to get this horrible illness, because it is a horrible illness potentially for everybody, not just for elderly people and people with chronic illnesses. Young people are getting quite sick. We haven't seen a lot of young children get sick, but again, it's early. It's still relatively early. As you said, this is only a 3 or 4 month old illness. Even when it was in Asia, that was just several months ago. This hasn't been around for years. We don't know what it's going to happen, how it's going to affect all of the population. So vaccines are critical. The reason why we don't have one right now is because it has to be tested. It has to be tested for safety and efficacy. And it's very complicated, and that can take even a year. Is a very, very, very short period of time to get a vaccine up and going.
I agree, and I was checking the timelines of vaccine development in the past. If the same thing was happening 20 years ago, it will take like 5 to 6 years to get
Right.
a vaccine going. And right now, a lot of people go like, no, they were ready for us, and they were ready with like, no, wait. Remember that we had SARS, that's another coronavirus. We have MERS, that it was another coronavirus.
Right.
And there were a lot of medications and stuff that started going with that. And the other thing that we have right now that 20 years ago didn't even exist, only in movies, was artificial intelligence. Right now we have protein bases in computers, and matching a possible effective vaccine, it's actually a real thing. And that way, the process that you're saying, yes, we need to do that safety way, because we need to make sure that it works on the computer, it works on animals, and after that, with the big animals, then making sure that we're safe.
Right.
And that's one of the things that I love about vaccines, because we're actually making sure that they are the safest medication that we apply to any human being, because we're giving it to healthy people, not to get sick. Sick. It's not like, oh, I have an arrhythmia, I need my pill, or I have my blood pressure, I need my pill. No. You're prevented. Right. And that's one of the things that I love. And right now, I'm actually getting some information from Mexico City as we're speaking. And they're telling me a couple of things. They were on the fence on vitamins, and I have my feeling regarding this, and I always show the evidence-based part of it. And right now they are going, okay, but what about this vitamin or that vitamin? And I know that nothing has changed in the past 4 months, but what do you think about that?
Right. So I think the biggies for this one have been vitamin C and vitamin D, right? And so both of those are good vitamins. So first of all, we need to just understand the very, very basics about them. So vitamin C is water soluble, meaning that if you take a lot of it, it's just going to come out. Your kidneys are going to, right? Cheers. Well, this is coffee, but it's going to go right through, right? It's going to go right through your system, out through your kidneys and your urine. So if you take a vitamin C pill, if you take, the recommended daily allowance is 60 milligrams. Okay. The vitamin C pills are 250, 500, 1,000, 2,000. It's fine. It's going to go right through you. Not going to hurt you. Vitamin D is fat soluble, right? It's one of the fat soluble vitamins, so it's metabolized in your liver. There's a lot of sort of discussion about vitamin C deficiency, especially in women. And that is something that you should discuss with your doctor if you are truly vitamin D deficient, and you need to take a supplement. Will taking extra vitamin C and extra vitamin D prevent you from getting this virus? The answer is clearly no. Will it treat the virus? The answer is the same. The answer is no. Will they hurt you? Probably not. Can they help you? Maybe a little bit. You should be having a balanced diet. It's hard to get produce these days, but if you can get an orange and have an orange every day, there's plenty of vitamin C in one orange. And, plus it has all the other stuff, the fiber and some hydration in it. So, you need to have a balanced diet as best as you can. If you are truly vitamin D deficient, and that is, again, something that needs to be discussed with your doctor, then you can be taking vitamin D supplements. Other than that, these are not the cure-alls or the prevention for this virus, and do not rely on any vitamin supplement for that.
I completely agree with you, and I'm seeing right now a lot of and they ask me, like, what's your secret for this? Like, don't tell absolutely anybody. It's 5 things. Like, and they're like, they get
write it down.
Like, yeah, the notes and everything. They're like, what's going to happen? Like, okay, there's something called diet. Like, what's a special diet? It's actually right now it's the other way around. Is what do I need to eat? Like, no, wait, stop what you're eating. It goes the other way. Like, stop soda, stop chips, stop snacking. Right. That's the first thing.
Good. Yeah. Easy.
Stop that.
Yeah.
If you can do that, that's good. Like, and after that, they go like, and what's next? Like, you need to do exercise. Exercise. Do you need to run a marathon? Like, no. Like, right now that you're at home and you're watching TV, because we know that you're watching TV and you're doing screens and all that stuff, it's extremely important that you actually are moving. And what's the special app where, like, you just stand up and you march in front of the TV, like, yes, and that's good. You do half an hour. The first half an hour of TV shows, of anything that you're watching, do it, or screen playing, anything, gaming. Yeah. The first half an hour at least march. For kids, 60 minutes. Then at least you put your exercise there. Like, oh, it starts like, it's doable. I'm already there on TV. Let's march. And the third and fourth one is like, I need to be sleeping, making sure no screens 1 or 2 hours before. And that actually goes with exercise, goes with diet, and that improves. And the other thing that we're having a lot, and I want to have your intake of this one, is that, the stress part of it.
Yeah.
Being at home and being destroyed of your regular routine. You used to, Dr. Shapiro, you were on hospitals, you were teaching, you were on ORs, you were checking patients, you were jumping all over. And right now, when they switched that routine to a different routine, we're all hurting, especially right now that you put an entire family in a capsule. Of course, there's a lot of stress. What do you recommend for that?
I was thinking about that, because it changes every day. And I think one of the hardest things about this, being so locked into your home and locked into this new routine, is the unknown. So, if we were told, this is going to be for this number of weeks, months, or however long, I think a lot of people would feel a little less stressed. So if we really knew, for instance, in Los Angeles, they're saying May 15th. If we really knew that we can wake up on May 16th and get back to our lives, I think the stress would be a lot less. The problem is we are waiting for somebody to say, actually, it's not May 15th. It's June 1st. Actually, it's not June 1st. It's June 15th. It's July 1st. It's July 15th. And I think the stress of the unknown, especially for people like us who are pretty control oriented and routine oriented, is really, really difficult. It's hard for our families. It's hard for our kids. It's hard for our patients. It's hard for, just daily life. So I think you have to there's nothing we can do about that. So we have to see what we can do, because, the loss of control, I think, is very stressful for a lot of people. So what can we control?
That's exactly that's what I said to my wife. Well, like the first week was horrible because the routine, the school, everything
Yeah.
was destroyed.
Right.
We had plans. I needed to get this graduation, my certification, my kids, the whatever, the festival, whatever. And after that, it was like, wait. I never had control of anything.
Right.
Right. And after I was like, oh yeah, you then we're going back to the basics of what can we feel and how can we treat other people.
Right.
And that's the basic things. Like
that's all we can do.
exactly.
Yeah. And we can control our own environments a lot more than we thought. Exactly. So, a lot of people who are not in healthcare are saying, well, I feel helpless. I feel like I'm not doing anything. What can I do? And, the answer is being home and being safe and staying healthy is doing 1,000 times more than you can ever imagine. And I know you've said this and I've said this before, is just staying at home helps everybody. It feels like you're doing nothing, but you are really doing something. Going out and going out with friends, and we've all seen this, people sneaking around in groups or not even sneaking around. That's not helping anybody. That's being very hurtful and very harmful. But staying away and keeping distance and staying home and staying healthy is doing a lot, I think. And then people feel like they have a little more control, and we do as well. I mean, it's really hard, certainly for what I'm doing is, when my patients say, well, when can we have our child's surgery? Even if it's not an emergency, but it needs to be done. When do you think that will happen? And, my guess is as good as theirs. I said, when it's safe, that's when it'll happen. And I'll be here for you, assuming I'm healthy. So, I think that we all just have to let go a little bit, because as you said, nothing is in our control. And I think, occasionally if you, especially if you have kids and you think that, you feel like my world is being rocked and shut down, it is literally the entire world that is going through this. Not Los Angeles, not Mexico City, not California. It is the entire planet that is dealing with this, which is really unprecedented.
And this is the beautiful part of this. I was actually having that conversation with a doctor from Spain. He is from Mexico, trained in Mexico, ended up in Spain, and his family actually fought one war, and the grandparents, and they were asked to defend the country with a machine gun.
Oh, right.
And going out there and defend people and put the lives of their own kids and children and their own lives to defend something. Right now, he told me, like, right now, the only thing that we're asking in Spain is, like, defend your country from your home. That's it. It's yes, right. There's pain involved with it. There will be problems, like economic problems, yes, but the sooner we control it in a region, the sooner we control it on a continent, the sooner we control it in the world, the better we'll be with actually responding to the entire thing. And whatever we're learning right now, well, this will continue coming. We thought it was going to be in the H1N1 in 2009. We thought a little bit in SARS, a little bit of MERS, but this will continue to evolve, and it will, it will happen.
Yeah, they're going to be, and people are talking about that already. What is the new normal going to be? And again, we still don't know that. We know what our normal is now, which is not normal life. We don't know what it will be 2 weeks, 4 weeks, 4 months from now, 4 years from now, but it will not be what it was. And, and soon we will all, as a world, accommodate to whatever that new reality is, whatever the new reality is, that we will incorporate it into our lives. And there's really nothing we can do about it now except to sort of, take each day one day at a time. It's very difficult because we're all used to making plans. We're all used to, having a certain way of life. We know that, what are you doing? What are your children doing for the summer? What are your children doing in the fall? What are you doing for your work life, for your family life, for your activities, for your events, for birthday parties, etc. And we can't make any of those plans. Everything is penciled in. Everything is contingent, no matter how far out you're looking, whether you're looking for the summer, the fall, the winter, everything is up in the air. And it's very frustrating. It's very difficult. And, you know, there's nothing we can do about it except to just let go a little bit.
What are you doing, you know, if you don't mind me asking, what
Yeah.
are you doing with this new routine that is helping you?
So what's helping me is I'm trying to get more sleep because we don't, you know, certainly as surgeons and busy families, you know, so I am sleeping a little bit later than I usually do as far as waking up in the morning, but not too much later. I think, you know, if you're used to getting up to go to work at a certain hour, don't sleep till 10 in the morning every day. It's tempting, and some of us can't for various reasons. But you know, I think it is better to keep somewhat of a schedule for yourself, whatever that is, and literally make it a schedule and say, I'm going to get up at this hour. I'm going to have breakfast at this hour. I'm going to exercise at this hour. These are the hours I'm going to be at work. This is the 15 minutes I'm going to be spending online reading stories about COVID and all these horrible things. I'm not going to be scrolling my feeds every second of every day. I'm going to put down my technology and schedule in time that you can look at technology. But then most of the day you really shouldn't be, because it's not productive. You're not going to miss anything. People are always concerned, like, I'm going to miss that one news conference where they're going to tell this is the answer, or this is the day I can go outside and I missed it. You're not going to miss anything. It will be there for you. So read books, I think, is a good thing. Read a novel. Go outside when you can safely. I think it is good to walk around your neighborhood if you can. Most cities are now, or certainly cities are requiring that you wear a mask outside. You know, certainly if you're in a public area like a grocery store or a pharmacy, you absolutely need to wear a mask. And be with your family. And I think one of the things that we absolutely all need to do is to find some silver linings, because they do exist. And it's really easy to discount those as not being important. So for instance, many families don't have regular family dinners. If they have kids in sports or busy school lives or busy work lives. So maybe you're having more family dinners. Maybe you're cooking together. Maybe you're talking more with your kids, spending more time with your kids. And a lot of people are grumbling that they're spending more time with their kids. And I know the kids are grumbling that they're spending more time with their parents, but we have to look at the positives of that. Another positive is that in healthcare, I think that, you know, we've really joined together, not only within our own little fiefdoms or our own little specialties, but looking broadly at other healthcare providers, nurses, respiratory therapists, intensive care unit specialists, anesthesiologists, infectious disease specialists. The list goes on as far as how much more support we're giving each other, appreciating each other, checking in on each other. I think that's been really nice. And that's something that we don't necessarily, we take each other for granted so much that now I think we're really gaining more appreciation.
The first time, I didn't know that the 8 p.m. thing was happening in Spain. That was the first time that I actually ever heard it. And I was talking with my friend, that the doctor that they told. And by the way, he got caught. The one that I was telling you about, he actually got. He works on the ER. He got COVID. He was 27 days.
Wow. Yeah.
Because he was still testing positive for it.
Wow.
He was actually 27 days in his house with in middle of Madrid, with the family. Then it was like very humbling experience for him. But
yes.
He showed me at 8 p.m. how everybody united and started like clapping for healthcare workers, for police officers, for people that are in the services.
Right.
And that was just amazing. It was just amazing, because a lot of people go like, okay, look, Shapiro, okay, I'm staying home. Check. I'm washing my hands. Check. Like, and how can I help humanity? There's tons of ways that you can do it.
Yeah. Yeah.
And that's the beautiful part. You know, like, and probably you have a couple of ideas. Mine were like, make sure that you're taking care of your fellow family members. Call absolutely everybody that you can call. If you can cook and give food to someone that is, you know, elderly, more than 65, that are not getting out, give to them. And the other thing for sure was, like if you can donate your time by phone or money wise
Mm-hmm.
to societies, foundations, clinic,
True.
hospitals, we all need your help.
Yeah. Yeah. That's great. And yeah, I think that, and you can do that from your home. You don't have to leave the house to do that. People there's so many ways to support other people. Again, just by taking care of yourself, taking care of your family, your extended family, friends, check in on people who are living alone. Certainly. I know that even healthy people who live alone are very concerned. What if I get sick? Who's going to check on me? How am I going to know if I'm dehydrated or if I have a high fever, if I am having breathing trouble, if I live by myself? So, check in on those people as often as you can. And, you can even set up a network of, how to sort of branch out and get in touch with people. I think that's great. If you can financially support, I know a lot of hospitals have ways, methods for you to donate meals without having to walk into a hospital and bring in some food, donate supplies. There are a lot of different ways to support all the different people. Or something as simple as, if you can, order in takeout food, delivery food, and, give extra tips to these people who are actually working and bringing you your food, and supporting them. And that, supports local restaurants, because, so many establishments are closing because they're not getting the usual support that they're getting. So, there are a lot of different ways that you can do it. And a lot of it, you don't even realize how supportive you're being by doing that.
Correct, and it gives purpose. And I have seen that purpose. I have seen people bringing the cloth masks to doctors or
Mm-hmm.
to the
Yeah.
things. And the other thing is, it's amazing how much we're in the entire thing of how we see each other as a community has changed. Like of course, with in type of crisis, and you probably see like the best things and the worst things
Yeah.
of
Yeah.
humanity.
Yeah.
I'm actually choosing to see what can I learn and explore and actually
Mm-hmm.
exploit and use it for other places on the world. And right now, for example, in Mexico and other countries, they starting the process that we were like 3 or 4 weeks ago, like, oh my God, this is real. Oh my God, we
Right.
need to close what? Oh my God,
Right.
and preparing the health system. And what do you think? Because this is a question that they ask me a lot. What do you think that are the learnings from California as us as a health system for the entire world? What do you think that they need to learn from us?
Yeah, I think California has actually done a really good job. I think one of the ways that this worked, is that the request or the requirement to stay at home was before the cases of COVID had surged even close. It was still a very low number of cases. People were very upset that they closed everything. But we were closing at about the same time as a lot of the East Coast cities that were already seeing so many cases. So we closed, I think, a day or two before New York closed. And New York was already having so many sick people, and the hospitals were already being flooded. So I think for the rest of the world, if they haven't yet seen these, caseloads that a lot of the other cities saw, close before that happens. Once it already happens, it's literally too late, and you're really going to suffer. So I think that's one thing that California has done really well. We have the luxury, just as the way California is built, is there are fewer really congested cities. We don't have the cities like New York City or Detroit, or parts of New Jersey where everything is so close together. Things are, we always complain about everything being so spread out in California, but that's actually been to our advantage. Just the physical distancing has been a positive for us because we don't have to be on top of each other.
The other thing that we both live in the LA area, and one of the things that I loved was the sincerity from the governor and the mayor.
Yeah.
And
Yeah.
what do I mean with sincerity? Usually, like there's usually a lot of jargon when you talk to the
Yeah.
people, when you go
Yeah.
to the public setting, and you need to give information. But they were truthful. They were like,
Yes. Yeah.
this is what we know. And
Right.
recently,
Yeah.
the governor, they were like, when are we opening? Like, in 15 days, I will start thinking of this.
Right.
And
Right.
we're trying to create a plan for sure. Yes, there's people thinking of that, but
Yeah.
and need more information, and things will change. And right now that we're seeing that we did a great job on flattening the curve, it does have consequences, meaning that the population will get sick in different times in a spread time. That's the objective, but
Right.
it will last longer.
Right.
Then
Yes.
that's the next conversation that probably we'll be having in the
Yeah.
next couple of weeks.
Yeah. I mean, our governor was, spoke on Monday, just a few days ago, and people were saying, oh, he's going to give us the date. He's going to tell us when we can go back. And that was not the goal. And he said, I'm not telling you when, but I'm telling you what we're going to need to get there. We're going to need this, this, this. And he gave us a list. And I think, yes, it's true. Our governor and our mayor they've been humanized, and, they are living through this just as much as we are. They're giving us good information. They're very accessible. And they're easy to listen to, I think, as opposed to, I feel like it's a real conversation. And as opposed to dreading a lot of these news conferences, I actually look forward to them because I feel like they're giving good information, and they're speaking with us, not at us. And that's been a really good
and
thing.
this is weird to have the idea of a politician, but they are honest.
Yes.
When they do not know, they say,
Yeah.
well,
I don't know. Yeah.
we don't know.
Yeah. Yeah. And, everything is tentative, and, we're starting to hear things about 2021 now as possibilities. They're not locking anything in as far as, everything is closed through next January, but they're just throwing it out there as, here's a possibility. Just, keep this in mind. And I think that's being honest. They don't know.
And that's the conversation that I think that and I know that you do it with your patient. It's what we know, what we don't know, and what we wish that we knew, and
right.
we want it to happen that way, but there's no way to know. And that's kind of the we're on the diagnosis part of it, then rather than the treatment part of it. And one of the things that at the beginning they were showing me a lot of these miracle things. And and I'm going to start with the simple ones, and I'm going to scale them all the way up. The simple ones were like, if you get certain type of temperature of water inside of your mouth,
yes, I heard that.
It in a certain way, in a certain time, would that help? What do you think about that one?
Right. So I saw this long list that was circulating around line. You probably saw the same list, and one of them was drink hot water. Yeah, drink hot water every 20 minutes or something like that, right? And that's going to burn out the virus. So first of all, drinking hot water is fine. It's good for you. It's not bad for you. It's not going to hurt anything unless it's really too hot and it scalds you. It's good to stay hydrated. A lot of people like drinking warm water. I drink it at work, just so I don't drink too much coffee, and it's cold at work. But it's, the virus is a respiratory virus. It doesn't go into your stomach. So it's not, the idea is that, it's stuck in the back of your throat and it's going to peel it off of the back of your throat. Not really. I mean, we know that soap and water is what gets rid of this virus because it has this sort of lipid coating to it. So that's how the soap breaks it down. But hot water is not going to do that. Again, it's not going to hurt you, but it's not going to do anything. And then let's put all those teas with that water too. So all of the lotions and potions and the teas that people drink with that hot water, same thing. It's not bad for you. It's not going to do anything though.
One of the things that I was hearing is, like right now we're doing a lot of testing, right? And everybody, us as human beings, we want to make sure that we're safe and we have as much information, and we're craving information and like something, especially right now that we live in a on-demand thing that I want this now, and Amazon, it's going to take only one day. No, I need it now. Then on that virtue of thought, a lot of people are trying to do these things as a miracle thing. And one of my favorite ones for testing if you actually have it or not, it's the next one. You stop breathing for 10 seconds, and if you cannot cough, you're good.
Oh, wow. Are you okay?
Almost there. Then I saw this one. It was like, I would love to say yes to that one because that way we don't need to use millions of dollars on testing sites
Great. Yeah.
and epidemiological things. We can actually have an app like taking your picture of you not breathing for 10 seconds, and we will make the diagnosis that you're okay. And I get the point that the virus goes to your lungs, and it's important to do that part, but that doesn't diagnose squat.
Anything. So first of all, that's going to make people who have other sorts of breathing issues like asthma or, you know, allergies or any sort of like completely unrelated breathing problem completely panicked. Second of all, a lot of people who have COVID-19 don't present with any sort of breathing trouble at all. And it doesn't mean anything. It really, it's useless. Yeah.
Now that we're talking about potions, I have heard of this. I love this one because it's when you play with acidity and basic things and you combine them to make sure that your body reacts to it. I heard when you combine vinegar for certain things and club soda or like a bubbly thing that has bicarb or you unite them both and you put a little bit of lemon, that actually helps destroy the virus.
Wow, that's gross. No. Will you drink it after that? Or you wash it?
That's
Put it on your salad.
And they do it like a rinse to to do that part and actually drink it too. But the concept is actually from the mouth part and balancing your pH part of it in your entire body. And when I get that part, it's like your body's an amazing machine. It actually regulates in less than minutes, seconds sometimes, with your breathing and your kidneys, that pH.
Yes. You can't do that. You can't drink something acidic and make your body acidic. You can't drink something alkaline, like alkaline water. That's a big thing. That's not going to change. That's not going to make you alkaline. It's not going to, you know, change your body's pH. It's incredibly complicated. And we are so lucky and fortunate to have kidneys and, you know, other regulatory internal organs that balance our pH, or else we would all be sick and dying on a regular basis based on what we eat or drink. If you eat some spicy food or something acidic and you become acidotic, that's deadly. So, you know, we have internal organs for that. And, you know, the idea of drinking something alkaline, there's stomach acid. That's what's going to make it neutral. That neutralizes everything. So all of that sort of playing with chemistry to change your body's pH is nonsense and potentially dangerous. I mean, you could be, you know, harming yourself by taking a lot of this stuff.
Right now, I'm going to go with one of my other ones that I read was using chlorine, bleach.
Oh, bleach! Wash your clothes with that. Yeah, you can bleach your hair.
Exactly.
You can bleach your clothes. You can wash your surfaces with Clorox wipes. It's very, very dangerous to put it in your mouth. We used to take care of lye ingestions, you know, LYE, you know, the cleaning solution ingestions, you know, back in the days before childproofing, where children would drink laundry detergent, and, you know, it's deadly to do stuff like that. So don't drink chlorine. Chlorine, you know, if you have a pool, you need chlorine in the pool, keeps things clean. Wash your clothes with Clorox. Yeah, that's it. Surfaces. And, you know, if you need to bleach your hair because you're home, it doesn't matter. You know, throw some Clorox on that. Don't do that.
Nina, you're a surgeon. You know the importance of actually a glove, right? You know perfectly well how important is that shield. Right now I'm seeing, and we will finish probably with the conversation of the masks and stuff, but what's your message to the community regarding gloves and coronavirus, COVID-19?
Right. So, you know, people are wearing gloves now in the supermarkets. I think that's the biggie. So you put on your pair of gloves, and assuming these are one-time use gloves. So that's, you know, first of all, if you're going to use any gloves, they have to be thrown out. This is a one-time use. You cannot wash these gloves. Okay. So let's say you get out of your car and you put your gloves on, and you walk into the grocery store, and it's an automatic door, so you haven't touched anything. And then you're holding your cell phone, and, you know, your neighbor texts you while you're at the grocery store, and then all of a sudden you're touching your filthy cell phone. Can you pick up some chips, because I really need some chips? and you're touching your cell phone, and then you say, okay, and then all of a sudden your cell phone rings, and you put your phone onto your dirty face, and they say what brand of chips they want, and then you've got dirt over here, and your glove is filthy, and then you're touching the food, and you're assuming that the food is sterile, just like your gloves are. So when we're surgeons and we put on sterile gloves, if we touch something off of our surgical field, our gloves are then dirty. Even if it's something quote unquote clean, our gloves are now contaminated, and we need to change our gloves. People don't understand that, and there's no reason that they should. They're not surgeons. But
Right.
gloves are a false protection. They're fine to wear, but they are not a substitute for washing your hands and not touching your face. So people I see they're touching their face with their gloves, and the gloves have contaminants from the products in the store, and that's actually worse because you feel more comfortable touching your face if you have a glove on, but it's not any cleaner than just touching them with your filthy hands.
Correct.
So I don't want them to be a substitute for hand washing, and we're not talking about not touching your face anymore. That was like the number one thing for a week. And we stopped talking about it, maybe because it's everyone staying home. It doesn't make it any cleaner to touch your face just because you're in your house. It's still gross, and you have to get out of that habit. Your eyes are part of your respiratory system. Your eyes, your nose, your mouth. And if you have a hole in your eardrum, your ears are too. So they're not a substitute for hand washing and not touching your face.
I love that one. And the other thing is that we know that specifically what you were saying, that, the point of entry is your eyes, nose, throat, your mouth, and of course ears. When you were mentioning that part, skin is not one of them.
Right.
Then
Right.
that's
It
why
doesn't go through your skin. Yeah.
the
People
virus
don't
doesn't
understand that. Yeah.
exactly. The virus doesn't go there. Then you can be gloved all over, but if you're doing all that stuff with your cell phone and your chips and everything else, you're still unsafe. Then that's one of the things that I hate. And by the way, I'm seeing tons of gloves all over the streets.
Oh, the streets. That's terrible. Not nice. Yeah.
Then we went from water, we went to poisonous chloride and everything. Is there anyone that you want to mention right now, or a couple of them that you want to mention?
One of them I've heard about coming back is silver, colloidal silver, which is like this drink that contains silver, and you can either drink it and it's supposed to help you kill the virus, or you can even use it as an inhaler. Extremely dangerous. And the FDA actually called out, and this was even a month ago, about 7 companies, and several of them were selling colloidal silver and inhaled silver, large companies, on television and online, to cure and prevent the virus. And this is really, really, really dangerous. So that's one that's a big no. The essential oils, they're fine. They're lovely. They're, wellness products if you have the extra, money to buy things like that, but it's not going to cure or prevent anything. Bone broth is another one. It's certainly, I think it's like a soup or something, and that's fine if you want to have soup, but it's not going to cure or prevent any of this as well.
Yeah, no, and again, and I'm the same way. We have that feeling of we need control, and we need to make sure that you're only telling us to wash our hands and stay at home, and is this enough? And
yes.
we're trying to fight that thoughts of how can I protect my family and myself and the community in an efficient way. And we need to be careful with that urge, and make sure that you're doing good stuff. And like we're talking about, like the basic diet part, move, sleep well, stress part of it. Those are like 4 pillars of things that you can just save yourself,
and they make a difference. Yeah.
And the beautiful part is it doesn't. The secret of this is it doesn't just help you fight against coronavirus, but it helps you against diabetes, cancer, and all other stuff.
Heart disease, lung disease. Right. Yeah.
That's kind of on the good cure of this. Nina, any last message, anything that you want to share with everybody before we say goodbye?
Well, we were going to talk briefly about masks because I think
Yes.
that's a big question now. So, a lot of cities have required people to wear a face covering while they're out in public. So, a couple things to just remember, regardless of whatever you want to cover your face with, whether it's a turtleneck sweater that you fold up, or a bandana, or a surgical mask, don't use the N95s. We need them in healthcare, so you should be donating those if you have them. But any sort of face covering, the thing to remember is a couple things. Your breathing on it contaminates the inside once you put it on. So that's one. It's already dirty. Once you breathe a couple of times inside the mask, you would never share it with another person, right? Because it's already dirty. If you're in contact with anything from the outside world, the outer part of your mask is also contaminated once it's worn. So it's really important not to fiddle with it, because if you touch the mask and then touch your eyes, that's worse than not wearing a mask at all for your own protection. So you always want to make sure if you have it, if whether it's strapped in the back or whether it's strapped along your ears, that that's what you touch. If you're using cloth masks of any, or cloth of any material, wearing it once, it's dirty. Okay. So it needs to be laundered or hand washed, but it's not to be worn several times per day or for several days. That's a one-time use. You don't have to throw it out, but it needs to be washed just as you would wash your underwear. Okay. You wear your underwear, you wash it. Okay. It's the same sort of thing. So, I think that's just to keep in mind for masks. The other thing for masks, and again, they are required in many cities now, and it'll probably continue, is it is not a substitute for physical distancing. Wearing a mask does not mean that you can go hang out with your friends in a close environment. And we're all wearing masks so we can go back to having our kids having play dates, or go out for coffee together, or go for walks together, play tennis together, go running or hiking together. It is not a substitute for that. You still need to keep that at least 6 foot of physical distance.
I agree with that. And, one of the things that everybody's asking you, like, can we run, can we do exercise outside? Yeah, the virus is not like lurking outside of your house,
right,
and waiting until you're there, like, no,
right.
It's okay to move, even
Yes.
if you're like 65 years of age. It's okay to move,
Yeah.
make sure that you have
Yeah.
that safe, your mask, your social distancing, and that actually will make a huge difference.
Yeah.
I have, my son sending me a message that I need to pursue. It's Papi, te quiero mucho.
Oh, sweet.
Yeah.
Nice.
And it's very important right now that that we continue this type of conversations with everybody. Yeah. And one of the things that I really want to communicate with everybody is it's the importance of doing the things that we do not need to do. We need to make sure that we are not sharing that message that we do not know that it's coming from the CDC, the WHO, or your public health, department. Because if we start sharing all this junk regarding colloidal silver,
right,
the thing about vinegar or acidic or alkaline stuff, at the end of the day, the only thing that we're hurting is ourselves.
Right.
And people have been hurt. There's people that end up on the hospitals. We have had the cases in France, in the States, and stuff like that they are trying to do this type of miracle cures, and it's just only hurting themselves, and we're hurting each other. Then, whenever in doubt, and you have that feeling that I don't know if it's real or not, just don't send it.
Right.
This is, you have more
bad. It's harmful. Yeah, it's true. Yeah.
Nina, well, thank you for your time.
Thank you.
It was a pleasure to be with you.
It was great. Yeah, a lot of fun.
And for sure, can I see the little thing that you have there, the green one?
What?
Like a book?
Oh.
Thing? One of my favorite books. It's amazing. And I actually heard her talk to it in the audiobook version of it.
Oh, good. Yeah, you can listen to me for 10 and a half hours and get the Hype audiobook.
I'm telling you, I already know you.
There you go. Yeah, I'm blabbing for 10 hours. You can get an audiobook. You can get Hype on Kindle. You can get ebook. You can get the hard copy still delivering. So it's sort of a myth buster. And even though it was written in the pre-COVID times, it gives you the tools for really any sort of new health issue, vaccine issue, health trends, vitamins, all that kind of stuff, how to sort of navigate the internet and all of the information coming at us. And so hopefully it'll be helpful.
I'm looking forward for the one that talks about coronavirus.
Right. Yeah. COVID hype. Right.
It has been a pleasure, Dr. Shapiro. Thank you so much.
Thank you, Dr. Shapiro. Yes. Yeah. A lot of fun.
For being part of this, and we will be in touch. And thank you for your time.
You too. Stay well. Bye, guys. Bye.
This is the fun part because end.